Hi, this is Dr. Geetha Reddy, IVF specialist from Amrutha Fertility Center, Karimnagar. There is a certain case infertility, like it's called secondary infertility. So what's secondary infertility? In such couples, they do conceive the first time very soon, spontaneously, and there was no problem in conceiving the first one. And after the first pregnancy, usually we advise them to take a 2 years gap. So even after 2 years, or even when they are trying to conceive the second time or third time, probably some of them, so they don't conceive. So in all such cases, when they have been trying to conceive for at least 6 months to 1 year in case of secondary infertility, and yet they are not able to conceive, then they have to undergo evaluation for their infertility causes. So it's again, they have to go to a gynecologist or a fertility specialist to evaluate themselves, and the causes may be again in the male, in the female, or in both of them, or sometimes the cause may not be found. So like primary infertility, again they have the causes most of the times in ovaries, either polycystic ovaries or premature ovarian failure, or sometimes chocolate cysts in the ovaries, or the tube and ovarian relationship is disturbed either because of previous any surgeries or infections, or the tubes are blocked because of the infections and tuberculosis, or there are fibroids in the uterus, or there are polyps, endometrial polyps in the endometrial cavity, or the endometrium is disturbed and the endometrial layer is not well formed, like in Asherman syndrome. Or sometimes when in the first pregnancy they have excessive blood loss, so in such cases also they go into amenorrhea, they don't ovulate, and the endometrium is not well formed. And in all such cases they have to get evaluated, and they have good results when they come early. And likewise, even the male might have got his semen parameters might have been disturbed due to maybe some unknown causes, or maybe due to infections or any surgeries. That is why even the male has to get evaluated. Maybe his semen count has gone low, or there are abnormal forms, or there must have been infection in the semen. So the earlier the better. When they come earlier, once they start trying to conceive and they didn't conceive in secondary infertility cases from between 6 months to 1 year, it's always better they approach the doctor and get treated earlier. Thank you.